Coming into an intensive care unit is incredibly risky. The chances of dying overall are about 1 in 5. We want to do everything we can to maximize everyone's chances.
And we realize that there are a lot of different harms that can happen to patients around when we do procedures with patients, but also missing points of their care.
At Brigham and Women's Hospital, we believe that one of the main ways to eliminate preventable harms is to partner with patients and to provide them with tools so that they can have that core set of information they need to engage in their care and communicate with us. And that's what we're doing with Prospect.
There are many different interprofessional disciplines that are caring for the patient, and sometimes the explanations we offer aren't really clear to patients.
There are many opportunities to do a better job with that. We've showed that if you get doctors and nurses to ask patients and families what they expect and then try hard to meet those expectations, that care goes better.
Prospect is a set of tools that helps us provide patients with information, with context about their hospitalization, and gives them input into their plan of care so that the patients, the rest of the care team can all be on the same page and hopefully help the patient to progress through the hospitalization.
If you really want to improve patient and family experience, you have to be attentive to the dignity and respect. And by saying that, basically we want to be attentive to the patient needs, concern, expectations.
I think the most powerful piece is when I actually listen to the lived experiences of patients and families. These are data points that patients are giving us, and it enables us to understand what should we do differently.
Prospect includes a structured team communication model, which we call the patient satisfactive model.
The patient satisfactive model really helps to support us identifying what are the individual needs of those patients. It gives a real structure to how we get that done. So it's not just about asking the patient what their needs are, it's about responding to their needs, communicating those needs with the rest of the healthcare team.
Then we have a web-based patient-centered toolkit. It includes both patient-facing tools and provider-facing tools. So the patient-facing tools would be the patient plan of care, where the patients can be involved in letting us know what they think their primary problem is or reason for hospitalization, what their goal is for the hospitalization.
The patient or their family member is able to take an iPad, look at it, get a snapshot of what's going on.
Their medications, who's on their care team, their schedule, what goals are on their plan of care, and what their role is in those goals. The other feature that I think is quite transformative is patients being able to communicate directly with their providers using the microblog. Patients really want to be able to ask questions when they're ready to do that, and sometimes that means when they're alone. And so through the patient-centered toolkit, the patients can post a question or a concern on the microblog, and then the care team will view that, perhaps have a discussion, and then come back and address it with the patient.
This patient portal tool is very helpful in giving patients some control over their care, and it makes them feel better connected. It's really just knowing that somebody really cares and that they're listening and that we can continue a dialogue.
It has a patient thread for patient-provider messaging, and then it has a provider thread for communication amongst the provider.
Delivering care in the ICU is incredibly complicated, and teams are working just at top speed a lot of the time.
This idea of siloed conversations that are happening, and a lot of it's happening asynchronously on through email and through text messaging, and a lot of the conversations are one way. So why not use a single forum where everyone, if you identify all the care team members up front, you allow everyone to view the same conversation, then everyone can be on the same page.
We use the patient safety checklist during interdisciplinary rounds every morning. With the Prospect study, now at Brigham and Women's Hospital, we're moving that patient safety checklist to an electronic version. Everybody on the team now has that information available.
And we will not only try to do a good job with those checklists, but we'll show to the patients and their families how we're doing on those checklists.
Prospect will really give us a way through both the non-technology and the technology components to assure that we've established as best as possible with the patient and the family achievable goals that the patient would want to have.
Prospect stands for promoting respect and ongoing safety through patient-centeredness, engagement, communication, and technology. If you think about it, what we're trying to do is promote patient-centered care.
We're all working towards a common mission of providing the best care possible to our patients. We need our patients and their families to partner with us in order to achieve that goal.
What is so inspiring about Prospect is, I think it's really the operationalization of patient-centered care.
With the tools that we're putting in place, will enable everybody to get much more on the same page. This is a paradigm change.